everyone. I'm Stephanie with 9 Health. Joining you once again, we've talked all week about ways to help during this coronavirus and ways to receive help as well. Today we wanted to just take a little break, get a recipe, something easy we can make this weekend or tonight, an easy dinner idea since I'm sure all of us have been in our kitchens doing breakfast, lunch, dinner, staying in our homes, maybe cooking more than we're used to in our houses. I want to introduce you. I have to go with my phone to Zoom because, again, I was having some Zoom difficulties. I think it's just a very popular way to communicate right now. So I'm on my phone. I will show you who I'm joined with. I have Dr. Jennifer Bolton. She is a dietitian and a professor at Metro State University in Denver. She's going to give us our recipe, and we'll talk with her in just a moment. And 9 Health expert Dr. Pal Coley is also joining us, and she's going to give us the latest on the coronavirus, and she'll probably have to she'll have to get off of here in just a moment because she's in the 4 o'clock show at 9 News. But I wanted to get an update from her really quickly. So Dr. Coley, can you give us the latest today?
Yes, so we had two big updates in the last couple of days. The first, just a few minutes ago, came from our governor, which said that now he is requesting everybody to wear masks when they leave their home. And again, we've been talking about this, but that has been a big change. And the thinking is mostly because we're worried that those asymptomatic people without symptoms, without coughing, without sneezing, just by talking or breathing outside are spreading the infection to others. And there are 25 to 50% of cases, so a lot more than we had initially expected. So if everybody wears masks, we're doing two things. One is we're protecting others from ourselves, which is the main reason that we're recommending this. And then there is some degree of protection that's offered to us from others by wearing the mask. Now, certainly we have to be careful because we don't want to touch our face too much when we're wearing it. And there are ways to put it on and take it off that we'll be talking about on Monday on 9 News that you can watch. But from this point on, everyone should be wearing a cloth mask when they leave their home. So that's the first update. And then the second update involves testing. So the state of Colorado has now really tried to ramp up their testing. They're doing 2,000 tests a day, but the governor did announce in his press conference that they can do up to 10,000 tests. And as we've talked about in the past, once we start testing, not only will it help us get a handle of what this virus is doing, but it'll also help us realize who we can release from social distancing and staying at home, and who still has to continue to do so. So 2 big, exciting updates in the fight against this epidemic today.
Great. And just to reiterate, I heard the governor say, we can use just our T-shirts or scarves. And again, it's to protect others from droplets from our own mouths, not necessarily droplets from getting to us.
Yes, exactly. Now, there's some degree of protection for things getting in. But again, as you said, the primary driver is really things getting out. Most effective materials have been cotton and pillow cover materials. And usually a double layer is more effective than a single layer. It does have to be breathable, however. So you have to make sure that it's not so thick that you can't, breathe through it, because the point is to have it on whenever you're outside, whenever you're leaving the home. The governor also said that as soon as you come home, the first thing you do is take it off and just touch the straps. Don't touch the front and don't touch the inside, and put it in the wash right away, because you don't want to be contaminating your hands or anything like that by touching the mask or handling it in an improper fashion.
Perfect. Okay, thank you for that update. I will let you go. We're going to talk to Jennifer Bolton and get a recipe from her in just a moment. Dr. Coley will be on 9 News at 4 with some of the latest on the coronavirus as well, so tune in and watch her on that as well. Thank you, Dr. Coley.
Thank you.
All right, Dr. Bolton, I'm going to switch this to speaker view. Again, let me give you a little spiel of what I'm doing again. I'm Stephanie. I'm with 9 Health in my kitchen because we're going to cook up some easy recipe with Dr. Bolton. And Zoom is failing me today, so I'm on my phone, but I'm also with Dr. Bolton on Zoom. Just couldn't go live to Facebook with it. So she will give us the latest from her kitchen on what we can make using staples and things that you will likely find in your pantry and your fridge. I have some things on my counter, beans, quick oats, oatmeal, pasta, things that we should probably have on hand, but she's going to tell us, she's the expert, she's going to really tell us what we should have on hand. And I surprisingly don't have as much as I thought I had. So let's go to Dr. Bolton. First, Dr. Bolton, we talked to you before about this idea about culinary medicine, preventing chronic disease with food. Explain what we're making today and maybe the health benefits behind some of the ingredients.
So what we're making today is called Easy Minestrone Stew, Stephanie. And so this is vegetarian today, and we'll do some other recipes next week that include meat. You could add meat to this. We've talked about that before. If you want to add meat to things, you can. Culinary medicine is the idea of prevention of disease using food and other lifestyle factors. And so one of the things we know is that in order to fight any disease, whether it's chronic or something like COVID-19. We're talking about needing a strong immune system. Part of having a strong immune system is eating lots of fruits and vegetables, whole grains, getting adequate sleep, moving your body, managing stress, all the things we've talked about before.
Perfect. And we got our update from Dr. Coley about the coronavirus. She had to sign off. Someone did just ask what kind of mask is recommended. The governor said today that we should all be wearing masks if we leave the house for essential duties. They're saying just cotton material is fine, needs to be breathable, should be double layer. And to save, those N95 respirator masks for the hospital workers, for the healthcare workers. But you can use, a scarf. The governor even said a t-shirt, but Dr. Coley said double layer cotton is the best thing to cover mouth and nose when you leave the house for essential duties. And my dog needs to go out, because that's the life we're in right now. Working from home, managing things from home, Zoom not working. All right, let's go back to Dr. Bolton. Again, we're in the kitchen today. We're trying to do an easy recipe for some of us that maybe need an idea after being in our kitchens all week. So Dr. Bolton, I will go back to you. Let's get cooking. I'll let you kind of take it away with what we're doing today.
So in the spirit of this recipe, I have my kids helping me. This is easy enough that one of my younger kids could put this together. My older kids are great cooks, but my younger kids could put this together too. And in the spirit of just working with what you have in your pantry, I really did choose a recipe based on what I had in my pantry. And we'll talk about that in a minute. So what we have today is easy minestrone soup. I want you to know I washed my hands first. I did it as long as A to Z. I said the alphabet, washed my hands, and now we're ready to go. So I've turned my burner on. I'm going to do a little bit of olive oil, okay? And then I'm going to put in a little bit of corn. It can be frozen corn. It can be canned corn. It doesn't matter. We're just going to put in the equivalent of a can of corn or a half a bag of frozen corn. And I'm going to move this around for about 3 minutes while it gets brown. So if you want to see that corn that I put in there already is already browned up and ready to go. Once the corn is brown, I'm going to add a tablespoon of tomato paste. I can eyeball the amount of tomato paste I need. So I stuck it in there, and we're going to let it brown up. That takes about a minute to brown up the tomato paste. And once the tomato paste is all brown, which gives it more flavor, we're going to then add in our spices. We've got rosemary and oregano, 1/4 teaspoon of oregano, 1/2 teaspoon of rosemary. I'm going to put it in my clean hands, and I'm going to rub it together to get all the flavor out of my rosemary. Once I've moved all that around together, then I'm going to add my vegetable broth. Again, to make this recipe vegetarian or containing no meat for people who are vegetarian, or it's Friday during Lent, we're going to use a vegetable broth. You can make your own vegetable broth. You can use vegetable broth that comes in cubes. You can use pre-made vegetable broth like I'm doing today. You're going to bring your vegetable broth to a boil. Once you've brought your vegetable broth to a boil, then you can add in all your other ingredients. So I'm going to have my daughter bring the computer over here and show you the rest of the ingredients. We've got a can of white beans. You can use cannellini beans, Great Northern beans. It's really up to you. And I've saved the liquid that they came in. We're going to add that at the very end to thicken it up. We've got a can of chopped tomatoes. We've got some green beans and a little bit of soy sauce. So that is the extent of what's in this recipe. So now that our vegetable broth is boiling, we're going to add in our chopped tomatoes. We're going to add in our white beans. We're going to add in this little bit of soy sauce. I know the physician we had on earlier was a cardiologist, so we only used a little bit of sodium in that low sodium soy sauce. And then the remainder of our ingredients are going to wait till the very end. So our green beans will go in about 2 minutes before we serve our soup. Our pasta will go in when we're ready to serve our soup. We're going to put our pasta into the boiling soup. It's going to cook for 8 to 9 minutes, depending on what type of pasta you've chosen. And then this liquid that came from the beans is going to be added at the very end to thicken our soup up a little bit. So let's assume that we're boiling here. We're going to add our green beans. We're going to add our pasta. Our pasta's going to cook 8 to 9 minutes. We're going to add our thickening liquid. And then we're going to add our green beans right before we serve, 2 minutes before we serve. And this is what we end up with. Pretty fantastic looking. I'll save some myself. This is what we're having for dinner tonight.
Hopefully it's what some of us can have for dinner, right? I'm sorry.
All right, so you've got that there. And thankfully, my husband made some bread this morning, so we're going to do that. Another really easy thing to do, make bread. You can start a starter in the morning or the night before, and then the amount of time investment you have for making homemade bread is only a few minutes every couple of hours, and then 20 minutes to bake it. So, Stephanie, here's what we have. Here's what we're eating for dinner tonight. You see everybody wiping down their counters all the time.
Right.
Here's what we have. We've got the soup. That's good. That's what we're having tonight. Is that what you're having tonight?
I wish it was what I was having tonight. I had told you earlier, I have some of those ingredients. I think I have the frozen corn. I think I have pasta. I don't know that I have the right kind of pasta for minestrone soup. I don't have broth, although vegetable broth is easy to make too, and even probably chicken broth, right? If someone doesn't have boxed broth, which is probably the easiest, is it easy to make your own broth?
Really easy to make vegetable broth. All those tops that when you're cutting carrots, cutting celery, cutting onions, all those leftover pieces that you're normally going to throw in the garbage, you're going to put into water and you simmer for a couple of hours, and that makes vegetable broth. You can make chicken broth by saving all of your chicken carcasses, throwing them in the freezer. And when you get 2 or 3, you put it in a big stock pan, and with some tops of onions, carrots, celery, let it cook for a couple of hours. You've got chicken stock. And that gives you a really flavorful stock, even better than what comes in the container. And Stephanie, we tried to decide if we were going to use elbows or some twirly pasta, really any small pasta that you have that can cook in about 7 to 10 minutes is great for minestrone soup.
Yeah, I was telling you, I think my husband stocked up on some things, and we got thick spaghetti, fettuccine Alfredo noodles, I don't know why I call them Alfredo noodles. I pulled out that I have canned soup. Obviously making this kind of soup is easy and just as easy really as it can. So it's nice when you have all these ingredients on hand, and really just pantry staples that we should all have. Can you tell me, maybe some people are making their list for this weekend on stuff they want to have for next week. What are things we should have in our homes right now for easy, healthy recipes?
Another meal that we did was a quick and easy one. That was pasta puttanesca. It was pasta, tomatoes. You can use anchovies, or you can use a canned tuna. And then you add in a little capers, a little onions. That's what we had the other day. That was a super meal. Well, let me show you what I think everyone should get in their pantry if possible. So if possible, we want beans. We probably want some black beans and some white beans and some pinto beans so you can make chilies and soups. Dried beans, this was $1.50. And this is the equivalent of probably 4 or 5 cans of beans. And so dried beans, all you have to do is soak them overnight, rinse them, and then they're ready to use. We can have tuna packets. We can have tuna cans. Tuna's a great protein, and with pasta, you can make tuna sandwiches. Tuna's a really versatile protein if you want some protein to keep in your pantry. And then figure out a way to make things yours. So if you like spicy and green chili, then have hatched green chilies on hand. Even better if you got them roasted and threw them in your freezer, right? Have some frozen vegetables on hand. Have some low-sodium canned vegetables on hand. And then that gives you a lot of opportunity to make a lot of different things. Have tomato paste. Have cans of tomatoes. Oats. And then you've got breakfast forever and ever. And you can go back through some of the old Facebook Lives that we've done and find those overnight oats and all the great things you can do with oats. And then if you want to have some broth in there, again, canned vegetables and pasta, any kind of pasta. I could probably make 15 different meals with the things that are right here. And I think we're going to do this for the next couple of weeks, so we'll have the opportunity not to make 15, but at least 3 or 4 more.
Yeah, we're planning on talking with Dr. Bolton again next week because, again, she just has a lot of good, easy recipes that are healthy. She's a registered dietitian. She's a professor at MSU Denver where she teaches nutrition classes, so she knows what she's talking about. She's good to listen to, good to get recipes from. I have the minestrone recipe on right now at 9healthfair.org. I'll post the link to the easy minestrone recipe she just shared. She talked about overnight oats. We have talked with her before about culinary medicine, using food to prevent chronic disease. And we do have a great overnight oats recipe that I will also post in the comments once we get off of here. Because again, I am using my phone to go live and showing her on Zoom because technology is fun. And I wanted to tell you a few things as well. Again, we talked about helping others this week. The state has a new website, helpcoloradonow.org, helpcoloradonow.org. To give or receive help, you can go there and find out about opportunities, including food assistance. We talked to the Food Bank of the Rockies. Foodbankrockies.org is their website. They can't take private food donations right now, but they can, they're looking for monetary donations, volunteering from healthy volunteers. So they need help right now as well. And at 9healthfair.org, you can click on volunteer and contact us. Even without the spring fairs going on this spring, we have volunteer opportunities. One of the opportunities that our volunteers are staffing is a 9 Health Neighbors line. So if you can't get on Facebook Live, or if you know neighbors that can't get on Facebook Live, don't have internet access, let them know about our 9 Health Neighbors line. You can call it as well, 303-698-4455, extension 2005. And you can call that number, leave a message with any question, a health question, really just anything though. We just want to hear from you. A doctor, nurse, one of our medical volunteers will call you back within 24 hours. And you can chat with them and ask them any questions that you would like. But call that number, leave a message, and we will give you a call back. It's just a great hotline, great resource for the community, especially our underserved community. So if you have anyone, neighbors, elderly neighbors that need to talk to someone, just let them know about that. I'm trying to think if there's anything else I need to cover. If you have any questions, you can post those in the comments, and I'll get them answered for you afterwards. And again, we're going to talk with Jennifer Bolton again next week. And Dr. Bolton, I just wanted to make sure, we talked about the minestrone recipe, how easy it is. Can you tell us again why it's obviously full of vegetables? What are the health benefits of that minestrone soup?
So we've got health benefits of the green beans and the tomatoes, all being full of antioxidants. Antioxidants help you fight off disease. We've got all the fiber in the beans. We've got some spices that we added. So all your fruits and vegetables contain antioxidants and vitamins and minerals that help boost your immune system. So we've talked about this before. It's hard for me to talk about food without talking about all the other parts too. So you need to also sleep 7 to 8 hours a night. You need to be managing your stress. You need to be eating fruits and vegetables and healthy foods like we've talked about here. I think there's the tendency when we're home, it's snowy outside, people think, I'll break out the chips or I'll break out the cookies. You can't have those foods. They're sometimes foods, right? But we want to make the basis of our diet all these healthy foods that contain fruits, vegetables, beans, nuts, seeds, whole grains, so we can boost our immune system and be as healthy as we possibly can. Connection with others is also one of the 6 pillars of lifestyle medicine. And so make sure that you're connecting with others, even if it is through Facebook because of social distancing.
Right, Facebook, Zoom, all these tools we have right now, they weren't working that well for me today, but we still got it done. We still got on here. Dr. Bolton, I will let you go. Thank you so much for joining us. We'll talk to her again next week. We'll come up with another yummy good recipe. And again, go to the 9 Health Neighbors line, 303-698-4455, extension 2005. Call that number with your health questions. Get a personal call back. We just really want to hear from you. And 9healthfair.org, that minestrone recipe is posted. I'll put it in the comments, and I'll also put this, the overnight oats recipe she referenced in the comments as well. And if you have ideas for recipes or things you want to see, comment here or contact us, and we'll get that content out to you as well. Thank you so much for joining us.